Morgan CHESKY joins me now from Dallas. Hey there, Morgan. So first, let's just talk about the fact, these masks have become very politicized. How are people reacting to these new mask requirements there?
Yeah, Savannah, they certainly have. And we've had a chance to kind of go and speak to a lot of the people going in and out of this Dallas Walmart behind me. And for the most part, people are behind the measure. And I think that that's particularly become even more true over the past several weeks as we've seen COVID cases in Texas and other states continue to rise with the states reopening. We do know that Walmart is opening more than a third, or Walmart has more than a third of their stores currently in states where there is no mask mandate in place. And as far as compliance goes, the company is only saying that they've stationed employees just outside those entrances, and they're calling them health ambassadors, reminding people that if they do go inside to a Walmart or a Sam's Club, they do need to have a mask on. We did have a chance to speak to several shoppers to kind of get their thoughts on this new policy that goes into effect today. And here's what they had to say.
It's just the right thing to do. School is getting ready to start. What are we going to do about that situation? We need to get this under control. And to start with is to wear your mask.
Instead of going down, we going up. It's going up. And the only way we go get the economy back going, we got to get it back down.
And Walmart, Sam's Club, not the only store doing this. We know Kroger and Home Depot, Harris Teeter grocery stores all plan to implement similar policies this week. Target has also announced that it will be putting a mask policy in place for all of its stores on August 1st. Savannah?
So, Morgan, that was one sort of opinion on the matter there. We're hearing those people before wearing those masks, but we've of course seen a lot of those viral videos of people sort of getting into these fights and these confrontations over them. Has there been any pushback to the new policy that you've seen?
I did have a chance to speak to one gentleman who says that, he had his mask in his hand. He says, if I have to put it on when I walk inside, I will, but it's uncomfortable, it's annoying. And he personally didn't believe in it, even when I said, hey, the studies are there. If you wear that, if I wear that, it can help keep all of us a little bit safer. I think there is a growing amount of frustration simply because a lot of people here, Savannah, in Texas, whenever the state reopened, they thought they were kind of more or less out of the woods. And then since then, really in May, when the state started to open back up, we've just seen those numbers continue to climb. And July has been particularly rough in that about 4,000 people have died in the state of Texas from COVID-19. And 20% of that number just took place last week. So it's becoming a more dire situation here, which I think will encourage people to buy in. But in the same breath, you're always going to have a handful of folks that are frustrated with any new rule that goes into effect. Savannah?
Let's switch gears now and just talk about Texas generally, since that's where you're coming to us from. I know Texas has seen more than 10,000 new coronavirus cases every day for the last 5 days. What is being done to slow the spread there?
Well, we know that Governor Greg Abbott back on July 2nd made a announcement that any county that had at least 20 COVID-19 cases would be required to have people put on a mask when they went into any establishment there. Now, depending upon where you are in the state, there will be different tiers on how, how many people will be allowed into a restaurant, things of that nature. So there is a mask policy for the state that's been put into place. But outside of that, it's really been left more up to a lot of the cities here in Texas. And mayors from major urban areas such as Houston, Dallas, have openly voiced their displeasure with some of the governor's leadership because they feel like with the governor's orders superseding their own, that their hands are tied when it comes to trying to contain COVID-19. And I think we're seeing kind of a consequence of that when we look at businesses now being the ones to come out, to be proactive, to put policies in place, not waiting on any local, state, or federal authority to tell them to do so, but putting those rules out there because they feel it's the right thing to do. As far as Texas goes, here in Dallas, we're anticipating that today will mark 17 days in a row of at least 1,000 new cases. And Dallas isn't even one of the hardest hit areas in the state. Down to the south, we know that Hidalgo County, just a few miles north of Mexico, has people waiting in ambulances outside hospitals because there aren't any open beds. And that's where we've seen some of those federal medical teams be deployed to try to assist and do whatever they can to make sure everyone who needs help gets it. Savannah?
Such tough news hearing as those ICU beds start to fill up. Another piece of tough news, 85 infants under the age of 1 tested positive for coronavirus in one Texas county since mid-March. Obviously, there's a lot we still don't know about this virus in general. Certainly one of those big things is how does it affect children? What are these other potential side effects that they get? What more do we know about that from this one county?
Yeah, there's a tragic statistic coming out of NUECES County, and that is where the city of Corpus Christi is located. A local leader there says that cases in that county are now outpacing the growth of any other urban area in Texas. We do know that a young child that was contained within that 85 number there lost his life just last week to COVID-19. As far as what it does to children, Savannah, that's one of the scariest parts about this virus, is because even doctors will tell you that the most read-in person on COVID-19 only has 7 months experience. They're learning more about this virus each and every day. Initially, we thought that it impacted the older population the hardest, which they are certainly susceptible. But from the older population to now, a group of infants there, we're seeing that everyone can certainly not only contract it, but suffer the very worst consequences imaginable from it. Savannah?
Absolutely. One of the few things that it seems we do know is that it seems like just about anyone can contract it. A good reminder to stay safe. Thank you so much, Morgan. There is promising news about a potential coronavirus vaccine. Early results from Oxford University say it could be ready by the end of the year. Researchers are now moving to more aggressive testing and even a clinical trial here in the U.S. NBC News senior international correspondent Keir Simmons reports from London.
Hey there, Savannah. This is very good news, albeit with a small trial, just over 1,000 people. There are already bigger trials underway with many thousands in different parts of the world. And I am told by a lead researcher at Oxford University that in the coming weeks, 30,000 people will be involved in another trial there in the US. But the results that they have published in The Lancet today, really, really positive, suggesting that this vaccine is safe and that it works, that it does encourage the body to produce antibodies. More than that, they are talking about this vaccine able to stimulate the body to a double defense so that it works to encourage the body to produce antibodies, but also at the cellular level, T cells. The antibodies attach themselves, this is simplistic, but basically this is how it works. The antibodies attach themselves to the virus itself, preventing it from getting into the human cells. The T cells attack human cells that have already been infected with the virus. So you get a kind of a double whammy, potentially, from this vaccine if it proves to be as good as it looks. And at the same time, the news that it appears to be safe, that there were some side effects, but only relatively minor. Again, very important because, of course, with a vaccine, it's important to establish that it can do the job you want it to do, but also that it doesn't do anything else that would harm people. So very, very positive. One lead researcher tells me that they think that they will have further results from bigger trials by the fall, maybe as soon as September, and that then he still hopes that they could produce a vaccine by the end of 2020. That is ambitious. They need everything to go right, but so far it has gone right. What they've done with this is, and this is one of the reasons they've been able to move so fast, is take a vaccine they were already working on, tweak it a little bit, if you like, for this coronavirus and keep going. So that's why they feel like they were able to hit the ground running. There are many, many vaccinations being worked on around the world. The perfect scenario is that a number of them turn out to work because the virus can change, and also because we're going to need a lot, billions potentially, of vaccinations.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.